We are starting a new year amid COVID-19 and authorities are looking to strengthen their respective strategies in light of the highly transmissible Omicron. Here in the studio, I have Professor David Kwak from Sooncheng University. Professor Kwak, it's good to see you again.
Good afternoon, Sunny.
I also have Professor Kim Moon-gyu at Yonsei University live on the line. Professor Kim, it's a pleasure to have you with us as well.
Thank you for having me.
Professor Kwak, we'll start here in the studio. A critical task for medical authorities here on the local front is tackling the number of severely ill patients, which has been hovering on the 1,000 level for about 2 weeks now. What appears to be challenging efforts to this end?
Well, it's not really a challenge that was unforeseen. As we've probably talked about this a couple of times before, the numbers in the ICU beds and also the mortality rate from the disease tends to sort of linger on much longer than the changes that we see in the daily confirmation cases. That's because these people do not necessarily suddenly come up with their severity of the disease, but rather they actually grow in the progression to reach the point to be admitted to the ICU beds and whatnot. And thankfully, I think, well, I can't say really thankfully, but the situation currently is being lingering at around 1,000 of cases out of 1,500 beds that are currently available. I believe the government is also making plans to further expand the bed numbers. But what I hope to see is that hopefully within the latter part of this week, or maybe going into next week, the drastic changes in the daily confirmation cases that started happening last week will also start to show up in the ICU bed capacity as well. So I'm hoping to see that maybe even gradually we'll start to see the decrease in the numbers that are taking parts in the ICU beds from hopefully next weekend on.
Right. And Professor Kim, how do you assess the spread of Omicron here on the local front?
Well, for Delta variant, it took 78 days to reach 1,000. But for Omicron, it was less than one month to reach 1,000, which is a very fast speed. And we must remember that there might be unknown cases, unrecognized cases. So we might have more numbers of Omicron in Korea right now. And as everybody knows, the last mutation takes over the previous mutants. And somebody expecting more than 10,000 in forthcoming days. But this does not necessarily mean all the patients are going to cause a huge public problem. If you look at UK, there's a rocket high increase in cases because of Omicron, but they kept the fatality very low, almost same as previous months. But we must keep an eye on this process and what should come out of this Omicron variant.
Right. And staying with Omicron, but moving beyond Korea, Greece ended last year with a fresh record in daily infections amid the presence of this new variant. For more on the situation there, I have Maria Kagilido live on the line. Maria, it's a pleasure to have you with us.
Hi there, good morning.
Right now, on Friday, Maria, that would be the last day of 2021, authorities there in Greece announced more than 40,000 new infections in a span of 24 hours. Do tell us a bit about the situation there.
Well, yes, just like in many other European countries, COVID-19 cases in Greece have been skyrocketing in the last few days. And most of them, in fact, over 70%, according to the health minister, are now due to the Omicron variant. This is Greece's fifth COVID wave, and it is absolutely dwarfing everything else that has happened in the past. As you said, on Friday, we had over 40,000 cases. Yesterday, we had over 17,000 cases, but that was after 2 days of public holidays, with very few tests being conducted. 61 people died, in fact, yesterday. What we've seen a huge rise in positivity rates. So yesterday, around 1 in 4 people that were tested positive. So we're seeing experts predicting yet another sharp rise in these cases. And the problem here, in fact, is that Greek ICUs are still crowded from the previous COVID wave. That was the Delta variant. So Greece's ICUs are still crowded with patients from the previous variant. And even though Omicron seems to be milder, people here are very, very troubled about what will happen in the next few weeks.
And how are authorities looking to deal with the burden on the medical staff there?
Well, they've tried to tighten restrictions. In fact, even though Greece never did away with all restrictions like other European countries, for example, there was still a mask mandate here for schools, for public transport and retail, the authorities felt they had to tighten them, and they had to tighten them in 4 different times in 2 weeks. So what had to happen was they decided to reduce or to limit the validity of vaccine passes for over 60s. So they're now only valid for 7 months. They're asking vaccinated travelers to Greece to provide a negative COVID test. This was previously a requirement only for people that hadn't been vaccinated. They are also asking restaurants to shut at midnight and to not play music. And other entertainment venues also have been barred from playing music. Everybody in entertainment venues has to be sitting down, and there's a table limit of up to 6 people per table. The government has also encouraged people to take more tests, and it has provided 2 free tests per person for the holiday period. But despite all this, cases still seem to be going up. And I have to say, for the most part, people have grudgingly accepted the need for these restrictions. And what we have seen is we've seen long queues outside testing centers and outside pharmacies. We've seen thousands of people rushing to get tested to meet with family and friends, because this is the most important holiday season. This is the season to be merry and to meet people that we've hardly seen in the last couple of years because of COVID-19. So overall, we've seen people generally accepting these measures, but everybody's dreading what's to come next.
Right. And speaking about measures, Maria, I hear those aged 60 and above may face a monthly fine if they fail to receive a first dose of the COVID-19 vaccine by mid-January. Could you explain the background behind this stern measure?
Well, the government was forced into this by the fact that unvaccinated over 60s were clogging up the country's hospitals. They were clogging up the country's intensive care units, and unfortunately, they were also passing away. So because there were over 500,000 unvaccinated elderly at the end of November, when the Prime Minister made this announcement, they were forced to go and take their first dose of the vaccine or complete their vaccination or schedule it before January 15th. After that time, they will be fined €100 a month. And now this is a very significant amount for Greek pensioners, who on average get around €700 a month for their pension. We've seen this measure working quite well in the last few weeks. Essentially, 150,000 of these people, almost 1 in 3, has gotten vaccinated, and we're expecting more to get vaccinated at the last minute. But it's a race against time. Will they be able to get vaccinated before they get COVID?
Right, that is the million-dollar question. Maria, what has been the public response to this measure?
Well, I have to say, yes, there has been negative reaction. This has been augmented by social media. So you've seen lots of negative voices. People have been organizing against this, saying it violates their constitutional rights and so on. But I have to say that this is a small minority. In fact, the vast majority is in agreement. Over 7 in 10 Greeks are now vaccinated. That's adults, and around 7 in 10 of the general population are vaccinated. So I think people are seeing the sense in this, and I think people are also keen to see that the health system is not under pressure. I mean, I personally know 2 people had very serious operations postponed last month because the intensive care units were full. So I think generally there's this understanding that this measure is working. And what's more, the government announced yesterday that it's thinking of extending it to other groups. So the health minister said that within the next few weeks, we're going to see other groups being forced to get vaccinated in an effort to combat COVID-19 in the next few months, because experts are expecting this huge rise in cases due to Omicron.
I see. All right, Maria, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you.
Right. Well, back here in the studio then, Professor Kwak, here in Korea now, vaccine pass requirements have been expanded to include supermarkets and department stores. Some are saying this move hinders the unvaccinated from securing essential supplies. What are your thoughts?
Well, let me begin by stating my own personal statement on here. I'm a person who is strongly against any kind of mandates on any issues. If a certain party is to mandate the other party, then they should also be liable for anything that happens who are mandated to go through the process. So let me just lay that out in first so that I can make the other statements here. But I think vaccines, as everybody knows in the country, is currently clearly necessary. There are clear distinctions, clinically speaking, in those who haven't been vaccinated against those who have been vaccinated, let alone who were given booster shots. There is almost no person who were given booster shots to be contained in an ICU beds currently, but there are many people in the ICU beds that are unvaccinated. So in order to sort of boost the immunity rate among population, we need to come up with a method so that people will voluntarily receive vaccines. And I think there needs to be more attractive incentives that people would care for. I'm not entirely sure if this is the right thing to say, but maybe offer them some financial coupons, maybe support them financially to those people who were given booster shots. Give them really attractive incentives so that people feel much more happy about receiving the vaccines. But the reason I'm saying this is because with the mandate and with the forceful mandates especially, there is obviously going to be a setback from people. They will be a growing sentiment among people, even those who have received booster shots and all the completion of vaccines, would suddenly feel negative about receiving further vaccines. We should not create any of that sort, but instead we should inform people better that these are necessary, how much benefit the booster shots and the vaccines can offer them, and also maybe even give them the carrots that the people will care for.
Right. Professor Kim, vaccine pass requirements for teenagers, meanwhile, will be in place starting March. Do you see this requirement as perhaps boosting vaccine uptake among the young?
Most of the children who get vaccination do not have a serious effects out of that RNA vaccines. And the most hindering factor will be the safety profile. And the most famous one is the myocarditis. And the Korean data shows that from the age group 18, they had about 3 cases out of 100,000 vaccinations. And if it goes to more younger age, like 12 to 17, it becomes less frequent. And I think this pattern is almost similar with other countries such as Israel and USA. And strikingly, it is about 10 times more frequent in male adolescents. So how are we going to convince the population, the students and their parents? Yes, and the vaccine pass should also be put in because we want to encourage this group to get vaccinated, not as a punishment. I think our government need to collect our own data and show to our Koreans, and then we will show some differences in this vaccination program. And also, we should have to think about other new vaccines, such as Novavax, which might be more safe in this population.
Right, and I will get back to Novavax in a moment. Professor Kwak, also starting on this Monday is the necessity of booster shots to validate vaccination status if 6 months have passed since your second shot. What do you suggest to ensure a smooth application of this new measure?
Well, I actually presume that it is going to go smoothly as opposed to the many different countries around the world, because we are luckily one of the highest digitalized country where we would be able to carry these vaccine passes on a cell phone. For those people who are not able to do that, they will even be given a paper vaccine passes that prove that they have been either vaccinated or they are free to go wherever they want to because they are immunized through either the natural immunization or even vaccine immunization. I believe the vaccine passes also apply to those people who have been naturally immunized, meaning they have been infected priorly and received booster shots afterwards. So we just have to set a certain date out of a clear scientific study how valid or how for how long these passes should stay valid. I believe at the current status with the passes being available on the cell phones, I think it'll just go as smoothly.
Right, we'll keep our fingers crossed for that. Professor Kim, earlier on this Monday, Prime Minister Kim Buk-yeom spoke about authorities exploring a new COVID-19 strategy to better respond to Omicron. What is your advice?
I do welcome that statement because I was thinking that we need a new version of our quarantine program. I would say version 2.1, 2.0, like. And if we compare the original Wuhan strain, now we are dealing with Omicron, which is totally different in the spreading and the severity. Every country has their own strategy, but first of all, we have to think of our own situation. The antibody positive rate of our general population might be quite different from other Western countries. And this should be the basis when we start to make our new strategies. And are we going to focus on the high-risk groups, which might turn severe cases if get infected? Or are we going to use the same strategy to decrease the total number of this pandemic? I think it's time to think about the new quarantine strategies, and it should be based on facts and scientific evidences.
Right, and maybe a two-track policy then. Professor Kwak, this is something Professor Kim just mentioned. Now, Novavax's COVID-19 vaccine is expected to secure the green light within this month. What can you tell us about its safety?
Well, the biggest strong point of Novavax is that the type of the vaccine that it is currently being manufactured has been utilized in conventional uses of other vaccines. We have used it for influenza vaccines. We have used for human papilloma viruses. So it's not something entirely new that like an mRNA type. So as Dr. Kim already mentioned, it may be considered more safe to use in those in the younger ages and also even in extremely old ages who we are concerned about their safety from possible side effects from the ordinary vaccines that we're currently using against COVID-19. But on top of that, they have, through their clinical trials, already showed great efficacy towards all types of variants. So it's the efficacy plus the safety that it has shown with other vaccines already, that it's going to have an advantage over other types of vaccines.
Right. Professor Kim, do you see Novavax as prompting perhaps greater public vaccination then?
Well, as Professor Kwak mentioned, I think Novavax is a relatively safe vaccine, and many students are afraid of these RNA vaccines. And they visit emergency room because of chest pain or respiratory difficulty many times. We showed no abnormal results. So might be because of some emotional stress. So I think Novavax could be a second choice for many people, especially the younger age group. And before we start to use Novavax, I think it must be clear that how it's going to work out against Omicron, because this new mutant is going to be the dominant strain in near future.
Right. All right, Professor Kim, as always, thank you very much for your thoughts. And Professor Kwak here in the studio, thank you very much for your insights today.
Thank you.